Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody. I'm Mariatul Fitriasari as a postgraduate student at Epidemiology Public Health Faculty, Erlangga University. Today, I would like to share my presentation titled Childhood Tuberculosis, a Case Control Study in Surabaya Pulmonary Hospital. Tuberculosis remains one of the major causes of morbidity and mortality in the world. In 2014, about 1 million kids suffer from TB and 140,000 kids die because of TB every year. And in 2014, the number of children TB reached around 23,000 or about 7% from all notified TB cases. And the number of TB beta positive cases in children in 2015 was 154 cases. As shown on the graphic, that the children TB cases is increasing from number and percentage. In 2016, only 7 children TB cases from total 361 total TB cases, but in 2017, the number of children TB cases increasing into 19 cases from 277 total TB cases. Also, the graphic shows that the 2017 children TB cases at Surabaya Pulmonary Hospital is increasing 4.9%. The exposure and infection are the main factors of tuberculosis transmission, especially in children. And the method of this study, how about the goal? The goal is analyzing the risk factor for the incidence of TB children who live in the same house with adult TB patient at the Surabaya Pulmonary Hospital. The study was conducted in Surabaya with initial case data collection at the Surabaya Pulmonary Hospital in April to July 2017. This study was analytical and observational study using case control design. Case population of this study is all children aged 0 until 14 years during January until March who diagnosed by doctor has TB and registered based on TB in Surabaya Pulmonary Hospital also live with adult TB patient at least for 2 months before this research. And for the control population is all children aged 0 until 14 years who live around the case population and based on the interview never has clinical TB symptoms, also live with adult TB patient at least for 2 months before this research. And for the sample is sum of case and control population. And respondent was parents or guardian, and sample size is 2 to 2, 20 cases to 40 control. And sample method is simple random sampling, and data analysis is using univariate, bivariate, and multivariate. Characteristic description of TB children cases. Based on the description of the characteristic of children TB cases, the distribution of cases based on age was mostly in 0 until 4 years age group was 55%. And based on gender distribution was mostly men, 55%. And then based on source of infection was mostly coming from the father, it's about 30%. And next, based on the education of their parents are mostly in elementary school level, it's about 35%. And last, based on the number of family members living in the same household in 2 until 4%, it's about 55%. Bivariate analysis of the influence of risk factor with childhood TB, you can see on the table that the results show that the variables that influence of childhood TB incidents who live with adult pulmonary TB patients in bivariate are sputum smear for adult patient, long-term contact tuberculosis, and child nutritional status. Meanwhile, the BCG immunization record, number of transmission source, and knowledge of TB preventions are not significant for childhood TB. And for the multivariate analysis, significant factors in multivariate are the nutritional status of children and long-term contact tuberculosis. You can see at the table for the p-value. The result of this research is opposed by another research being done, such as Brembodo state that the most important factors in children's TB is their contact history. Contact with TB sufferers is a major risk factor for TB in children, so the closer and longer the contact, the greater risk of occurrence. And research in Sleman that poor nutritional status has 7 times the risk of the incidence of tuberculosis in children. The result of research by Aris in South Kalimantan explains that the status of undernourished children had 29 times risk of the incidence of tuberculosis in children. The sputum smear of adult pulmonary TB patients has the potential to influence the incidence of TB in children who live at home with adult pulmonary TB patients at Surabaya Pulmonary Hospital. Okay, for the conclusion, in conclusion, the most influential variable childhood TB incidents who live with adult pulmonary TB patients are child's nutritional status and long-term contact tuberculosis. Stakeholders have to do early diagnostic to break the chance of tuberculosis transmission with early household contact detections. Okay, this is the end of my presentation. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.